World's Youth Skills Day. And we've been having an event on skilling every year. And Ms. Moushumi Ghosh has organized excellent events in the past. And this year, I think it is very appropriate that we have a skilling discussion for the healthcare industry. We have excellent speakers. Our Secretary General, Mr. Dilip Chinoy, other than being a Secretary General of FICCI, he is a foremost expert on skilling. And so we look forward to hearing from Mr. Chinoy. Mr. Narayan Nigam, who comes next as the keynote speaker, he is has been doing an extraordinary job. And I have heard from very good experts and speakers the role he's played in West Bengal during this time in keeping us safe. We have Mr. Madhukar Bose, who joins from UK. And welcome, Mr. Bose, and look forward to hearing your views. Mr. Rupak Barua, who's in the front lines, so to speak. If something goes wrong, I usually dial his number. So we would hear from all of them and many other speakers who are going to follow during the panelist discussion. I think in general, the question of skilling, whenever the world gets into as tumultuous and extraordinary phase as we have gotten to now, the question of skilling becomes very relevant, because the skill set of a world which operated before COVID and the skill set of the world that will operate after COVID would have some differences. That is not just in the healthcare sector, that is in every sector. And in India, where we are still early in our journey, in our economic path, where our peak is far away from where we are today, getting the right skills for the next decade is critical. And this period makes us, requires us to change the sort of skilling we require. In the healthcare sector specifically, we have been blessed for many years because of our young population. And the fact that we got by spending as little as we do, between $1,000 to $2,000 per capita for healthcare, is because of that young population. But when something new like this virus spreads, which attacks, of course, the old, but also the young, and we need an infrastructure, we need to increase the capability of the skill set in the healthcare sector. Countries like Malaysia, countries like China, let alone developed OECD countries, spend multiples on healthcare. And India requires the right physical and human infrastructure for healthcare. However, there's massive opportunities for the country. Like India became the IT capital of the world in 2000, India can become the healthcare skills capital of the world in 2020. Today, with a very small population compared to India, Philippines has more nurses globally than India. There is massive need for healthcare professionals, doctors, nurses within India, where the number of doctors or number of nurses is half of what we need, or lower than half of what we need. But there's also a huge demand for healthcare professionals around the world, where India can be the leader. I greatly look forward to hearing deliberations on the subject. And again, on behalf of the State Council of FICCI, West Bengal, I welcome all of you and would request Mr. Dilip Chinoy, Secretary General of FICCI, to make a special address.
Thank you, Mr. Chatterjee, Chairman FICCI West Bengal State Council. Also very special welcome to Mr. N.S. Nigam, Secretary Health and Family Welfare Department, Government of West Bengal, and to all the panelists, Mr. Bose, Mr. Raghavan, Mr. Ashish Jain, and Mr. Rupak Barwa. Thank you for agreeing to be with us this afternoon and share your insights on the occasion of the World Skills Youth Skills Day. Of course, it was started in 2014. The Prime Minister, launched it on 15th July 2015 in India. And of course, today is the 6th anniversary of not only the celebrations, but also the 6th anniversary of the National Skills Mission. As the chairman mentioned, last year also FICCI West Bengal State Council celebrated the World Youth Skills Day. And the webinar deliberated on skilling, reskilling, changes, and new opportunities in the skilling landscape to meet new challenges. This year, of course, we focus on healthcare and a very important topic. But first of all, I want to recognize the great contribution that the healthcare entire sector, whether it's the hospitals, whether the doctors, nurses, the entire healthcare staff, the general duty assistants, and everybody who worked in the hospital, in the healthcare ecosystem, ambulance drivers, everybody want to really recognize their tremendous service to the nation and the people of the nation during the 2 waves of the pandemic that we are there. And it is only because of their sustained work and resilience that we have been able to minimize the number of fatalities and increase the rate of recovery going forward. And therefore, in that context, it is pretty clear that the skill development and knowledge enhancement in the healthcare sector is the need of the hour. The chairman mentioned the big gap that there is there, and it is a gap which varies from state to state, district to district. And we need a huge number of trained healthcare professionals at all levels. I would like to actually compliment Ashish and the Healthcare Sector Skill Council for actually starting this whole program across the country, and also Moshmi and the team, and also the West Bengal government for allowing FICCI to partner to do some very innovative work with companies and to augment the capabilities of the healthcare facility workers in the state. Actually, there are 3 requirements. One is skilling new people and actually getting them in place. The second is augmenting skills of people who are in particular jobs so long, but really do not possess the skills that are required to service that job. And the third is upskilling people so that they can actually career progress going forward. And in the healthcare sector is seeing great changes. We've had the National Telemedicine Act announced last year that brings in a whole new set of people going forward. Today's webinar brings together policymakers, health sector skill council, the skill providers in the health sector, hospitals, experts, international experts. And I think we're going to look at career options in healthcare, future job trends, including digital healthcare, etc. Again, it's a real privilege to have with us today Mr. N.S. Nigam, Secretary Health and Family Welfare Government of West Bengal. Thank you, sir. I know that you have to leave quickly, so I will end very shortly. And we also have eminent panelists and experts who will touch upon topics including digital health and how it is changing the healthcare delivery. Preventive healthcare and aged healthcare will be 2 areas that we need to look at in the future. And we also need to look at home care healthcare delivery, which actually was accelerated during the second cycle of the pandemic. I think FICCI recognizes that skill development is important, imperative for achieving India's ambition growth targets, and also health for all, and also servicing the Ayushman Bharat program that we have. In West Bengal also, like I said, we've partnered the government industry in several skill development initiatives. And I'm sure that all of you will find this very interesting, and we will take away a lot of learnings and lessons that we can augment the healthcare workforce in the state. So thank you, Chairman, for having me here, and keep well and keep safe.
Thank you, Mr. Chinoy, for your address. Mr. Nigam, we would like to hear from you, and please deliver your keynote address on to FICCI and to all the members on the skilling requirements for healthcare industry. Welcome, sir.
Thank you, Mr. Chatterjee, for all the kind words that you have given in the introduction part. Well, thanks for all the kind words, but it's a big teamwork in which there are more than lack of my colleagues who have worked along with me in this tiring time. I'm really thankful to all the assistance which has been provided both by the government, people in the government and people in the private sector like Mr. Barua and all. Whenever I have approached him for increasing his bed capacity or doing something more, he has been kind enough and he has coordinated with the entire private sector. I'm really thankful to everyone in the state. It was a time of unprecedented crisis. I don't know whether any public health crisis to this level any of us will see in our lifetime again, though it's a crisis, it's yet to be over. Thank you, Mr. Chinoy, for joining this program. Since FICCI is organizing this program, I am really thankful to each and every one of you, all the panelists who have taken out their busy time, busy schedule to deliberate on the issue. I will just put you certain parameter across the things. You know, with the COVID-19 pandemic taking place, once again, you know, the different era of healthcare country has witnessed. India got independence. We were 40 crore of our population. Today, we are a 130 crore population country. It's the same soil, same water, same sun. Today supports 80 crore additional set of people. Average, but we are the young country. In West Bengal, our total fertility rates have coming down. So the family planning program by and large with enlightenment has been a success. Immunization program of India has been an unprecedented success. If you look at it, this was one of the program like earlier we used to see so many polio cases. Even in a classroom, the people used to come with the polio cases or the tuberculosis or the smallpox, all those diseases we have taken care of, and the different era of development as the country progressed, so is the public health response kept on changing, and we kept on responding to the newer challenges and the newer heights we kept on achieving. Maybe a COVID-19 pandemic has also happened. The reasons are still to be debated by the experts, but the disease was definitely unknown to us. Still, our total knowledge of this disease is only a year and a half old. Its first case was reported sometimes in the December 2019, and we are in June 2021, July 2021. 1 year, 7 months, 7 and 8 months are all our knowledge, and a lot of progress has happened. In fact, if I tell you the response, why I'm trying to build up the little bit of a story here, is that the health sector is a resilient sector. In the first wave in West Bengal, which we have roughly handled the infection of 5.5 lakh with a mortality of more than 10,000. In the second wave, we have handled more than 11 lakh in 2 months, and the deaths were much lower. It was around 0.75%, 7,500. So the sector really responded. The capacities were there. They could be quickly upgraded. So why I'm building up is that the sector is resilient and it has a capability to grow and capability to take us to the newer heights. What do you mean by a development in a society? That if the birth of a child happens, the minute he comes to the mother's womb, he is taken care of by a system till his last breath, and everywhere at the right intervention, the right kind of healthcare is provided. If you look at the health sector so holistically, then the first phase of the healthcare country has responded, I will say, and we have got a reproductive and child health and the public health responses have been taken care of. Further, the COVID will further augment the resources and we are further improving our infrastructure. I think with all kind of resource allocation which is happening to this sector will definitely lead to a much more improvement in times to come. But where are the gaps that we come forward when you look at it as short time immediately? You have a doctor. What we think about healthcare? Healthcare, one sector is the availability of the doctors. Well, state, country per se is responding by adding more and more medical colleges are being added. Like in West Bengal in 2010, I was having a 10 medical 7 or 8 medical colleges. By next year, I will have a 24 government medical colleges. We will be producing roughly 500 plus medical graduates every year. So is in the homeopathic sector or any other sector. Similarly, there is another sector that we look at. It is a skill sector, is the nurses. The nurse sector, Mr. Barwa will agree, there is a huge shortfall which is there in the state. More and more institutions are required, both at the basic nursing level, that we call it GNM, or the BSc nursing and MSc nursing level, because there is a concept gradually which is in a process of chipping up, which is there abroad, is a kind of a practitioner nurse concept, that the nurses do extend a lot of medicine support and all, and the less critical diseases or the normal diseases are handled at that level, which happens in the regular hospital setup. So this is one place where we really feel that there is a huge gap that is there. But leave that doctor and nurses, which are supposed to be very dedicated cadre. Now with the advent of the electronics and the advent of the computer skills, you have a huge set of electronic equipments which are going into the system. You need a set of people not only to maintain those setups, but to run them also. You need a very specialized kind of training. Here, the first set of gap that starts coming in. Second is when we went ahead and improved our oxygen capacity, we realized that there are not enough skill set that is available who can help us in management of even the medical gas pipeline systems also. There are neither the material nor the skill set is there. Then you come towards the many other things. Even the cleaning, the facility management in a hospital is a highly sophisticated job. How a patient has to be taken on a stretcher, which way, what speed is to be done, where the person has to be taken is a highly skilled job. So unless even the management in a ward is a highly skilled job, which leg of the patient has to be first put on the ground and when it is done. All those, when you go to the hospital, then you realize a kind of skills that has to be required and that has to be developed. I am coming to the hospital. That is one part of that. You need lot of IT professionals, lot of equipment managers. You need lot of, the lower level, the facility managers, the caregivers. Is a hugely skill set. Which part of hand has to be held? How the hand of a person whose hand is broken has to be held? How he has to be driven in a stretcher? How the burn case has to be attended? The basic care patient care, which will not fall in the category where the doctors or the nurses are involved, but the basic people, the entire staff, entire ecosystem which has to develop its skill, and it is highly skill oriented job in which a 2 months, 3 months skills. I will tell you one example. We have certain government hospitals which are very good, and when we were develop any other hospital, we get a doctor, nurse, even the sweepers from the hospital where we are going to create a healthcare COVID care facility, first to a hospital where others are managing it well, put them in the real-time example, put them to a small little training of 10 to 15 days so that they are really get into hands-on. So this is what I am saying, that the entire hospital administration is going to be highly skill-oriented job in times to come. And with the advent in the advances of the technology, with the newer technologies being introduced, with the advent of the IT systems, this entire set has to be multi-skilled fellows that will be required in every hospital. Now, this is one part of it. But if you want to look at the Fit India, if you want to extend healthcare for all, the preventive part of it is also going to be very important. So you will need, all of us are morning consuming, the Ayush Kadhas or are doing a little yoga, but there is a skill that is required at that level. For an old person, for a young person, different kind of skills. Somehow we have taken always our body for the granted कि थोड़ा दौड़ लेंगे, थोड़ा खेल लेंगे, सब ठीक हो जाएगा. Again, it is a very skill-oriented job in which we will have to take care of it. So that ecosystem of yoga experts, your sports experts, your sports medicine, all those things are going to require in a huge number. Beginning has to be made somewhere. Not only that, there are a lot of big organizations are involved. They need to keep people, they need to provide them employment. Occupational health, how you sit in your office. If you do a 5 minutes yoga in the afternoon, how much skill set it leads to improvement. All those things are important to be taken care of. So this is the point number 2, that you need to really look at it, the health on move. When I am fit, how I will address the health issue. That is also going to be a very important part of it. Third is, though we take a huge pride that we are passing through the demographic dividend phase and our population is very young. Sir, this population is going to be old in another 15, 20 years. When this will be giving away with your TFR falling, you will have a far more old people to support in your system than the young people which are available. So whether we are looking at a geriatric care development or not, or the caregivers at home. Now, it is one sector which generally is neglected, but you look at the Salt Lake where my office is situated. Most of the people we find, they are staying, old parents are staying in censored, daughters are staying abroad, and there is no organized setup from where you can get a nurse or a caregiver, or the institutions are not responding to geriatric care. So gradually we need to really learn what are the different skill sets that are required other than the medicine and the doctor support. Like in our own medical college or hospitals, we are now trying to put up a geriatric clinics, geriatric specially trained doctors, organizing the training for them. But at the level of compounder, at the level of technicians, at the level of many other things, you need to take care of the geriatric care. So now we have to look at the emerging issues that will come across. There are countries which have developed it. We need to import the skills or the knowledge that they have done. Similarly, we have to find our own way of how to involve and take care of growing old population, because it is a time when we should start planning for it, so that after 10 to 15 years, as the old generation, the generation grows old, we have a set of people with a specialized facilities who can take care of it. Now, I come to another important part that we call it a smart medical setups. You know, when I was working in the power sector, the entire thinking started towards development of the smart grid. What is a smartness? You develop a lot of physical infrastructure. It's a time that you develop phenomenal physical infrastructure, that you have a digital X-rays, you have a CT scans, you have everything. But where are the smartness left? So you need to develop a smart layer which will connect everyone with the Internet of Things coming up, with the data networks coming up so far, with all the equipment being a computer compatible. Can we do something about developing a system in which, suppose I check my one CT scan in somewhere in Delhi, I come to Calcutta and I want to show it, can the person automatically download the entire system, and I carry entire my medical records in a digital inventory, and if someone can share. You know, this entire concept is going to come up as a form of National Digital Health Mission. Now, everyone will have a medical identity, which we see in many other advanced countries happens. Every data will be stored and you can be sharing across. Now, the issue comes that the different hospitals will have their own setups running on the different numbers. These numbers will have to be converted, or somehow the linking has to be established, so that there is a one-to-one correspondences, and the entire system, if I want my data to be shared, how it is going to be shared. Think about the opportunity this sector is going to put it open. Now, whether you believe it or not, we are still a very low spender in terms of our per capita expenditure on healthcare is one of the lowest in the world. Our government budgetary commitments are still in the process of growing up, but it is definitely to a lower end. Now, if you look at it, so I'm saying that the entire sector, even for the digital initiatives, this entire sector is going to take a quantum jump in next few years. And where are the manpower for that? Again, the importance of the skill in the healthcare sector is going to come up. So I will summarize. I will come to one more part of the Government of West Bengal initiative, then I will come to end. We run the biggest health insurance scheme in the country. We have a 10 crore people insured as a part of healthcare. We call it our Chief Minister's favorite scheme is Swasth Sathi scheme. There we have extended the scope. With the 2.1 crore families of West Bengal are covered with the assured 5 lakh healthcare, 5 lakh up to rupees 5 lakh for the per family has been insured, for which he can go to the government as well as to the private hospitals. There are around 2,000 plus hospitals. And you know, I'm not boasting about it. I was looking at the data of the National Health and Family Survey. The per capita expenditure, out-of-pocket expenditure on an average for a pregnancy across countries more than 7,500. In Bengal, it has come down to 2,500, much lower than that what was there in the NHFS 4 surveys. Published data only because of the assured health care being provided by the government of West Bengal. So this is what is again going. Who will manage this private hospital? Who will manage their digital integration? The issue comes about their quality of services. The issue comes about their cleanliness, because there are certain healthcare things have to be kept in mind. So as we move towards one era of, the government works in an era. So as we worked in there was an IT era, there was a communication era. Now both this era is over. The next decade maybe of the decade of healthcare, where the entire expenditure, the public policy discussions, everything will go towards this sector. So I'm really thankful to FICCI for organizing really some program in which you are really looking at a forward-looking concept has come up, how to take care of the skill deficit in the healthcare sector. Definitely I'm seeing a very eminent panelists are all around. I'm sure that some concrete suggestion will come forward from all the deliberations, and we will be definitely able to take care of proper guidance from the issues which the experts will highlight and come up with a solution in which we can ensure the proper health care for all. You know what we Sarve Bhavantu Sukhina, Sarve Santu Niramaya, Sarve Bhadrani Pashyantu Ma Kaschit Dukha Bhagave. With this word of Upanishad, I just thank you, Mr. Chatterjee, for giving me the opportunity.
Thank you, Mr. Nigam. This was of extraordinary breadth and understanding the scale and the scope of both the problems and the opportunity. This is not something that we can choose to do or choose not to do. Well, we can choose not to do at our peril as people. And if now, if it is not now, then it will be never. Because we have all had fear in our eyes in the last year at different times for close, near and dear ones. And as a nation, we have the massive opportunity in every segment in terms of skilling of people, in terms of bringing in technology, which we have as a country established as a position, in terms of education of doctors, in terms of really moving from one of the lowest healthcare spenders to making it an engine of the economy. And it is the best kind of skill because you're, after all, nurturing humanity. You're not only humanity with Indian citizenship, but humanity around the world. And as we saw with the coronavirus pandemic, unless the whole world becomes better and vaccinated and safe against coronavirus, it just moves from one country to another in a matter of days. It moved from some countries into India, and then there was a wave, and then there was a second wave, and it causes destruction from one state to another. And we've certainly, as Mr. Chinoy said, we cannot express in words the gratitude to everybody connected with the healthcare sector. And it's a gift that needs to keep on giving, because the challenge has not gone away. And but thank you, Mr. Nigam, for this excellent keynote, and you've set a very strong stage for what I think will be a tremendous panel. We would like to start with the discussion of digital health and how it is changing healthcare delivery and the skills required for this. And to discuss it, I think we have one of the best experts Mr. Madhukar Bose, who's the Deputy Head of Healthcare for Digital Health, Department of International Trade, Government of United Kingdom. Mr. Bose is responsible for UK's life sciences and healthcare trade effort, and also the digital health trade across markets. He has expertise in an international exposure in telemedicine, in bringing in technology to services in healthcare, and his primary interest lies in the strategic adoption of technology-enabled healthcare in both the private sector and public sector. Mr. Bose, we look forward to hearing from you.
Thank you, Rudra. I hope the audio and video are all working fine now.
Yes.
Great. Thank you so much for the opportunity to join and participate in this event. And I would not call myself an expert, but I would just bring upon what I've experienced and what I have known in my life and career so far. So I'm just going to start with just talking about why digital is important. We talk about the benefits of having a digital-oriented healthcare system in three ways. The first is access. To provide access to care to people who would otherwise not have any access. The second is quality. So how do we use technology to drive the quality and consistency of quality of care higher and higher all the time? And the third,
I think Mr. Bose's video
yeah,
got frozen.
Ask him to switch off the video. Maybe that's.
Let us wait for a minute, and I hope Mr. Bose will come back on. But
yes, I'm here.
Yes.
I'm here.
Yes.
Sorry about this. I seem to have
your video, Mr. Bose. That's fine.
I will do that. I will do that. Let's try that. Great. So I don't know where it got interrupted exactly, but I think I'm going to now move on to the key. I want to talk about two things. The key trends in digital healthcare, which will have a significant impact on the way healthcare is delivered, and secondly, the actual impact on the skills piece and the supply of those skills that the technology trends will place. So the first one is around technology trends is around AI, and not surprising. But on the AI side, I want to take it in two parts. The first is AI in primary care. Now, the role of primary care in making a health system sustainable is really, really important because this is where the patient is first seen, their needs are identified, and then that patient is directed to the appropriate part of the health system. Now, what we have seen in AI and primary care is that we are using AI to support frontline healthcare workers to identify the needs and appropriately route patients to different parts of the system, both in the UK and now increasingly in India. So we've run a project recently called the Healthcare AI Catalyst, where we provided technology solution on a handheld, on a tablet to ASHAs and ANMs with a clinical decision support tool provided by a company called Elsevier, which many of you have come across. Now, this solution incorporated standard treatment guidelines from Government of India in maternal and child health, and it allowed the system to digitize the journey of that patient. So where a patient is picked up with a problem, that patient and that case is then digitized, and that referral for that patient goes in a digital way to different parts of the health system. So where the medical officer receives that patient, they will have that information provided to them through that solution. So this was a project we ran to understand how AI can make a difference in rural and semi-rural areas. And I think there was a huge potential that it highlighted. The second example of this kind of application of AI in primary care is what we saw in the NHS around March, April last year when the pandemic really started taking hold. What happened in the NHS was we moved in the case of a week from being a primarily face-to-face led primary care to a primarily remote-based primary care, where people were either calling in or going online and through the NHS app were putting forward what their complaint was, health complaint was. And these, no matter where you came in, whether you came in on the phone or you came in through the digital channel, there was an algorithm that was analyzing your information and then trying to figure out where you were going to be seen, whether you were going to be seen in a clinic, where you just going to be kept at home, or did you require a hospital care? And this was automated to a great extent. And that trend is also visible in routine primary care, where you have softwares like eConsult and companies like Your.md who upskill nurses and paramedics, and thereby allowing them to take on that initial role of assessment and triage, and freeing up the doctor's time for doing the more complex interactions. Now I'm going to move on to the second part of AI, which is in the hospital space, and just mention how we have seen imaging-based diagnostics being transformed through the use of AI, and that's across a number of different specialty areas. But for example, we have a company called Behold.ai, which is working with Apollo, and their software, which was initially or originally used for detecting lung cancer through lung scan analysis, was rapidly repurposed and retrained to spot COVID from lung scans. And this is the largest deployment of its kind at the moment in the world. And this is just an example of how you could, again, free up radiologists' time, because radiologists are, a scarce supply, shortage of radiologists, and then how you can free up their time by using AI. The third trend I wanted to talk about was telemedicine. Just to point out the fact that it's a way of extending specialist care into underserved areas, but also very important to get second opinions, to follow up on complex and chronic cases, which would not be possible if we were not using kind of remote teleconsultation technology. The fourth one, very quickly again, is around telehealth and remote monitoring. So how do you look after patients who have long-term conditions at home? And this is trying to give them a proactive care to understand whether their health is getting worse. And if you can see that by monitoring their vital signs, then you can prevent their health from becoming much worse and provide early interventions. And the fifth trend that I wanted to finish with was self-care. People are using a huge number of wearable devices, around apps and combinations of those things to manage their own health. And I think Mr. Nigam was touching upon the idea of wellness. And this is all coming around to this trend of people trying to take more control of their own health, not only in terms of these apps and tools, but trying to then change their lifestyles around it. So what are the implications then of these trends on the supply of skills? Now, in the UK, we had a review in 2016 called the Vector Review, and it pointed out that the healthcare organizations of the future needed to take a digitally led approach to healthcare delivery. And what that meant in terms of roles was that a new kind of role was set up called the Chief Clinical Information Officer. And an NHS Digital Academy was set up to train these people, effectively leaders who were expected to develop a strong understanding of technology and increase their knowledge of how to use it to improve clinical decision making, and therefore have an impact on quality of care. So this was an example of a new type of role that was identified in terms of leadership. You then have upskilling of clinicians in the use of technology. And I think this is where the word opportunity and benefits come in. Because if you can take a benefits-led approach to showing how healthcare professionals can augment their own capabilities and augment their own time, then they will adopt technology. And it's not just the clinically trained professions, but also the kind of allied health professions who sometimes are quicker to adopt technology because they can see the benefits more. And the third impact I wanted to talk about was around coordinating and monitoring kind of roles. I was talking about telemedicine, I was talking about telehealth. Now, these are interventions where you need a new type of skill set. You need people who are either extending care into people's homes, so they don't have to be fully medically trained, but they just have to be enough trained in terms of use of technology, but also in terms of how coordinated care can work across different settings and different locations. The fourth and last point I wanted to highlight was the pure technology type skills that are required. Certainly for AI, for example, the requirement of data science type skills is huge. I mean, there's a big, massive shortage of trained data scientists in the world, and healthcare as an industry is no different. But the ideal here is to create people who have an element of clinical and medical understanding, who are able to embrace technology, not just in terms of using it, but actually in terms of designing and creating it. And then you've got the technologists who can implement and create and actually program and do the data science to bring these things to life. So I'm going to stop here because I know this obviously time is short and there are a lot of grounds. There is a lot of ground to cover. So thank you, Rudra, hand back to you.
Thank you, Mr. Bose. That was most insightful. During this period when the world was affected by COVID, healthcare you needed to use digital technology not only for COVID but for everything else, because it was very difficult to meet a doctor given the challenges of COVID. And also I don't think there has been so many people affected by something together. So the supply and demand issue obviously played a big role, and your insights are very important from what we learned. And we want to continue hearing on the role of technology. Many of you would have heard GE Healthcare in a couple of months ago. FICCI West Bengal members might have heard GE Healthcare talking to us about the protocols for COVID. We had a seminar where more than 100 healthcare professionals attended from the state of West Bengal. It was a seminar organized by FICCI with GE Healthcare. Today we have the pleasure of hearing and interacting with Mr. Girish Raghavan, who is the Chief Technology Officer of GE Healthcare and the steering committee member of India Edison Accelerator Program, which aims to create solutions that will help healthcare providers deliver precision health. GE Healthcare is looking across the sector in terms of preventative healthcare, precision diagnosis, and treatment in a timely and affordable manner. I am delighted to invite Mr. Raghavan to speak in this panel discussion.
So thank you, Mr. Rudra. To begin with, I would like to thank Mr. Rudra, Mr. Dilip, and Moshmi for giving me this opportunity. It's indeed a pleasure to be part of this forum and address this gathering. So for this discussion, I'm just bringing a different perspective from a technology standpoint on how technology is going to help bridge the skill gap what we have, right? So before we go to that, I would like to touch upon some of the macro level details, right? The challenges we are facing in the industry today. See, every year we have, and this is global data, right? Every year we have close to 160 million people who move from the poverty line to middle class, right? So with that movement comes higher propensity to pay. for healthcare services and systems, right? So that is one data, right? 160 million people going from poverty to middle class. On the other hand, the number of trained physicians, technologists, and the likes who are available are not going at the same proportion, right? So we are facing a significant challenge in availability of skilled technologists and radiologists and doctors and physicians who can treat the healthcare, the patients and the healthcare system. So we have got two contrasting data, right? And if you go back and see what is it leading to, right? So if you look at the statistics, especially in the US, it is told that the third largest cause of death in the US is because of medical errors, right? Right after cardiovascular and oncology, then comes medical errors. It is alarming. 9.4% of the people in 2012. Okay, it is an older data now; it should be higher. We should die because of clinical errors or medical errors. So if you put all these things together, right, a very important aspect comes the skill of the people who are going to take care of the ecosystem. So, and the whole forum, what Mr. Dilip and Rudra have been organizing is more focusing on how do we bridge the skill gap. So now, if you look from a GE Healthcare perspective, or from a technology company like GE Healthcare, or for that matter, any medical device company, our primary endeavor is to see how we can bridge the gap, right? So there are two ways of doing it, right? As the earlier speakers are talking about, on one way would be for us to get people more trained, more skilled, and you take them up. Other opportunities for us to see how we can lower the requirement what you have, so that you don't need very high skills to work on the healthcare system. So there are two ways of looking at it. So we are more focused on the latter, on seeing how we can make our systems more efficient, that it doesn't need high level of training and technology expertise to operate that. So what we have done in GE Healthcare, and what we're trying to do, and we have made some good progress, is we are trying to make our systems intelligent, right? So today, if you go to an hospital and you're doing a CT scan, right, the fundamental assumption is the scanner is dumb, right, and the operator is intelligent, right? The operator would tell scanner scan, it will scan. Stop, it will stop, right? It will say take images, it will take the images. Push images, it will push images. It is as basic as that. You just tell, it will just do, right? What we're working on is something totally radically different. We're trying to change the paradigm and say, okay, how does it look if the system is intelligent? Okay, and the system can tell the operator what to do. Okay, so some of the solutions what we have delivered today and is available in the market are some very simple things where before a scan starts, the CT system, for instance, would say, hey, wait, I think the patient on the table, right, is supposed to do a chest scan, and maybe the technologist is putting on the abdomen. So maybe it will be able to handle the technology and tell him what he should do, right? We have got solutions, which, for example, which will go and tell the technologist, look, you have 150 or 500 protocols in the system. I have seen the systems, I have seen the patient history, I've checked the EMR system, I've checked the risk system, I have seen everything. And I am recommending that out of the 500 protocols what you have, pick these three. These three are the most closest to this patient. And the technologist, instead of scratching his head and going to 500 protocols, can go to these three protocols and choose the one which is most relevant for it, right? Instead of calling the radiologist and checking with multiple people on what to use, right? So these are very simple things which we are trying to do to make the system intelligent. In the way we're trying to reduce the bar in which the bar of the expertise what you would need to operate these systems, right? The other example I would say is a very simple reporting, right? I don't know how many of you have had any of your family member or friends, who have gone through a PET scan or a CT or a MR scan. Reporting is very painful, right? You finished your PET scan, the patient would leave. It takes days, sometimes weeks. Okay, I know some of the best hospitals in the world where they take 10 days to get a report. It is very complex, right? Because it's a legal document. It goes through a lot of scrutiny. So the whole day, the physician is, clinician is busy going through so many scans. You have a lot of things piled up in the evening, no time that day, next day, right? It just keeps on going and finally has to sign off and give it off. In those 10 days, the amount of anxiety the patient goes through is unbelievable, right? So again, it needs high level of expertise to make a report. It needs a good amount of expertise to make a report, right? So what we are doing today is to have smart reporting. When the scan happens, right, before the patient leaves, or perhaps before the physician leaves, right, you have an auto-populated report, which has got most of the information filled, right, in a compliant manner as per the hospital's framework. And all it needs to be done is the physician or the technologist or the radiologist or the oncologist, right? You can take the report, review it, add some content, and then and he can just get the report signed and give it to the patient, right? So these are very simple things. So the fundamental philosophy of how we can reduce the bar or get the skill well done is to reduce the bar what it needs for people to be trained to operate on the system. So these are some simple examples on how technology is going to significantly help in reducing the skill gap what we are seeing today in the industry. And of course, GE as a company, as Mr. Rudra was alluding to, right? We do a lot of programs today. We have a separate, dedicated education business, which actually focuses on skilling people across the world, across the country, and making sure we have the right level of expertise in the country. So I would probably stop there, Mr. Rudra, and over to you.
Thank you, Mr. Raghavan. And I hope these technologies have rapid progress and become even faster at solving the kind of health issues that we are grappling with now and will grapple with in the future. As Mr. Nigam said, that the challenge is our nation has less money per capita to spend on health, and it's no longer going to get any younger than it is today. Thank you for your deep insights. I would like to call on someone I know very well, Mr. Rupak Borua, Director and Group CEO of AMRI Hospitals. He has been at the forefront of dealing with healthcare issues in our region for years. And in his, I have traveled with him during delegations, and I've seen the focus he has on healthcare in this region. And he has also very effectively dealt with the challenges. The MRI was at the forefront of giving care to many of us and many of our family members, and many of your family members, because they were expanding healthcare facilities, including with other FICCI members, such as with the Great Eastern Lalit Great Eastern Hotel and other locations. Mr. Borua, over to you.
Thank you so much, Rudra, for your kind words. And thank you, FICCI, for giving me an opportunity, Mr. Chinoy, Moshumi, and all, for participating in this program. It's one of the most important discussion we are having today. That is the skill development in healthcare sector. It is one of the most pertinent issues what we are facing particularly in this pandemic time, and we are discussing about what is going to happen in the post-pandemic time. Now, if we are talking about that, the COVID-19, if we see this is the pandemic COVID-19, which we are talking about, that's an extraordinary event that has impacted every nation, irrespective of this nation, and the business and the supply chain on our planet, because that has hugely impacted. Now, the pandemic left the healthcare system, if we are talking about in crisis, because as we are all discussing about the patients and all, so because the hospitals on the verge of collapse with their capacity overflowed. Now, particularly in the, we have faced a lot of issues in terms of your critical care supply chains, interruptions, then your personal protection gears, all those things we had hugely struggled during this year COVID time, which we are still, yes, of course, the situation is a little better right now, but still we are going through. Now, while government and private sector organizations also, as Mr. Nigam was mentioning, we work jointly together to overcome this crisis, but still, yes, it's a very, very hard learning sessions as well. Now, this pandemic time, what we have seen, the CEOs and the leaders of healthcare actually, healthcare provider system worldwide, I'm talking about, are dealing with unprecedented levels of demand in their hospitals and grappling with questions about how to provide optimal care. That was the major questions that which we used to face. They also face the pressing questions about what the future of healthcare provisions may look like in a post-COVID situation, post-COVID world. The experience of these last 1.5 years that which we are going through has demonstrated the potential for fundamental shifts across the care continuum. That we need to understand. Now, these shifts includes the design and construction of the facilities, the hospitals, what we have. There is a need of a lot of changes in the design and the construction part as well. We need to revisit our inventory management, particularly in the critical care segment, and the safety gears, personal protection gears. There is one of the major issue also challenges the optimal settings of care delivery and how it is reimbursed, because we'll have to again take care the best quality care at an affordable cost. That is one part. But one of the major issues which we have faced, it is the healthcare workforce and the training of the workforce, the skilled manpower in each and every segment that we had faced. When we are talking about quality healthcare and all, that is, it will come only because when you are having excellence in your operational process. Now, whenever we are talking about operational excellence, you will have to create to offer healthcare, better healthcare to a patient and at an affordable cost. Your manpower, the skilled manpower, trained manpower is very important that we need to look into. That is the major part that we have faced. Initially, what happened during this pandemic time, the patients started overflowing to the hospitals, whether it's a symptomatic or asymptomatic patient, because we are not having much of idea about the behavior of this COVID, because it's an invisible enemy. We are not knowing the behavior because never we have faced this kind of a situation. Then most of the time, what we could observe over the time, just when it started, and in few days' time, we could observe that we don't need the patients to get admitted, because most of the time, what we have seen, that the patients are mostly asymptomatic and less intensity infection, where they don't need admission, but is home quarantine. And if we can home healthcare support, if we can provide to the patient, that will be enough for a patient to recover from out of this COVID situation. That's as everyone we are talking about, if we could understand that yes, home healthcare is one of the major important vertical during this COVID, or maybe before the COVID situation also, we know that home healthcare is one of the most important. But enough kind of a manpower is not there. Skilled manpower I'm talking about, trained manpower talking about, because home healthcare is not only that is just giving your care, but if the home healthcare person will need to understand the nursing part, dietary part, even also the patient, the person will have to take care the psychological part as well of the patient. So it's one in many aspects that one has to understand. That needs a proper kind of a trained manpower, skilled manpower, and they will have to undergo some kind of a courses. That is one part that home healthcare, home health aid, that is very important. It's a huge scope, huge opportunity that we can see. That is one part that that is a need of the hour now. Now, during this year, running of the hospitals, majorly we have observed that we are quite heavily dependent on the nursing personnel. Many of the activities we try to manage with the nurses. Once again, you know that is a human resources, particularly doctor and nurses, is quite crisis in India. Overall, all over India as well. Millions of nurses, actually, there is a shortfall. If we start utilizing those nurses in this your non-clinical job, then the clinical job will be affected. So we could observe that there is a multi-skill health assistant is required to manage, this your, as Mr. Nigam was mentioning, the oxygen part. Who will handle this oxygen? You see, the oxygen crisis that we have observed during this year's second surge, there is a huge amount of wastage of oxygen also has taken place, because many people, many healthcare staff doesn't know how to handle this oxygen and the flow of oxygen. It has been observed that there is a lot of wastage of the oxygen. So it needs a trained personnel that we are talking about. That's multi-skill assistant who will be able to handle in many cases, that is some nursing part they can do, some, at least support to the nursing part, and the operational part they can do. That is one area of concern. Then we have, over the time, we could understand that we all have started talking about sanitization and hygiene. So that is also one of the most, we are talking about, have we sanitized the place? Have we sanitized the OT? Have you sanitized this thing? There is not much of understanding that the clinical part of the sanitization. Clinical part is what kind of your composition of the chemicals we'll have to use, what is our frequent hours we'll have to do. This is a very, very skilled job as well, because it's not only internal hospital part, external part as well. Even we can go to the community as well. We can support the community with this kind of a skilled manpower, the hygiene and your sanitation associate. That is a course also that we are already working with this. Maybe Ashish will be able to elaborate on those parts, because we are working with the Healthcare Skill Council very actively. We are working. So these are the courses we are working together. Then in infection control. So the person actually, the patient who is in the critical care, we have seen there is maybe number of days they are in the critical care. Once the patient is in critical care, there is a chance of infection, and then more of the antibiotic uses of the is required. And then ultimately, what is happening when we are giving a ultimatum to the patient, that is your quality healthcare at an affordable cost will not be able to match. So infection control assist supervisor is very important. That's a skill, extremely skilled. Though right now we are managing with the nurses and all, but support to the nurses, actually there is a required, is a, that is your infection control supervisor. Dietetic aid. In this kind of a pandemic situation, we have seen this is a diet of a patient is very important. How you are managing, particularly those who are in the quarantine, also those who are in this the asymptomatic patients, those who are not, we are suggesting not to admit in the hospital. They need a lot of support in this so we have started these teleconsultations, digital kind of a consultations and all to the patient, but there is a need of a proper kind of a dietetic support. So this dietetic aid, a short course, who will work under a trained dietitian, so that they can support as well to the patients. Now, that is one big area what we have seen, that is your emergency care assistant. There is a huge number of patients coming because this is a pandemic situation, but there is a post-pandemic also, if we see, there is a need of a proper kind of an emergency handling, those who understand that handle the emergency patients with the doctors and the emergency critical care. Now, critical care, the technicians also, this is also comes under this your emergency care assistant, where that in critical care, there are many high-end equipments we use. We use ventilator, we use BiPAP, we use nebulizer, we use your ECMO, but there is need of some technician who really understands, who has got this exposure in handling this kind of equipment. So there is one exposure, the course is required for the emergency care assistant. And end of the day, today, once we are all considering the taking care of the patient, one of the major shortfall that we could see in today's situation, that the COVID vaccination assistant. Again, I'm saying that most of the time we are using your nurses to do this your inoculation part that we are doing. That is we are using. But COVID vaccination assistant is very important. It is also a specialized job. There's a need, a lot of skill. And if we can produce this kind of a skill in this we can produce this kind of a human resources, both internal or external, because worldwide there is a demand. So there is an opportunity is huge. We can already, this your healthcare is the fifth highest employer, this healthcare in this across all the industry. That we can really project India as one of the skill developed country where we can export manpower, that the skill manpower we're talking about. So these are the areas actually I would like to highlight what my experiences during this COVID situation, handling very closely. And this is the demand or expectation as a healthcare service provider, as an administrator, I am expecting. The last last month, actually, Honorable Prime Minister has inaugurated some of the courses, 6 courses already he has inaugurated, and through this your Healthcare Council, through your NSDC, National Skill Development Council, there is a home care support, basic care support, advanced care support, emergency care support, sample collection support. That's also need a lot of your expertise, and medical equipment support. As Mr. Nigam was mentioning, that a crores of equipments we are buying, but how to handle those equipments and how to settle those equipments. So these are all the requirements, all these questions. We are rightly working it right now and hope that we'll be able to create a better kind of a healthcare service provider and will be able to extend quality care to the patient at an affordable cost. Thank you. Thank you.
Thank you, Mr. Barua. That was, you heard the demand side, and now we will hear from Mr. Ashish Jain, CEO of the Healthcare Sector Skill Council. He has you've heard him being referred to by several speakers before, and his goal and his work is to facilitate the creation of the robust and vibrant ecosystem for healthcare skill sets. Mr. Jain, welcome and look forward to hearing from you.
Thank you, Chairman. And I hope DC is still there and Mr. Nigam is still there. So actually, while before I got this invitation, I was thinking about talking about what initiatives Healthcare Sector Skill Council has taken this time. But I believe, I think some of them are already covered by our chairman for Eastern region already. Mr. Barua has already spoken about some of them, some DC has already covered. So what I'll try to do is briefly talk about some of the key initiatives, and then the certain issues which has come up in the discussion, I think raised by the Honorable Secretary of Health and Family Welfare, even technology aspect, and the G Healthcare representative also spoke about some. So I'll try and see how and what we are doing in these areas, so it will be a little more meaningful in what we're discussing. As I think Rupak just mentioned, the Honorable Prime Minister has recently on 18th of June launched 6 of the COVID-specific programs which are required to deal with specifically COVID-specific scenario in the country today. Idea is to create quickly the skilled workforce which is required for healthcare sector, and the ambitious target which has been kept is to train almost 100,000 people quickly in a shortest possible time before, if we are hit by any third wave, which is possibly expected to hit by September or October somewhere. If that is the case, probably we want it to be ready before that, and that's the preparation which is going on. And as and when I'm talking to you today, already trainings are underway, assessments are happening, and people are being sent on the on-the-job training with the healthcare facilities. So that's the process which is ongoing right now. Having said this, I also wanted to, because I think a lot of things has been spoken about the quality of the skilled workforce and the quality of training. So I wanted to ensure the audience here and the respective panelists which are there, that whatever training is being done under the Skill India mission, whatever training is being done under the Healthcare Sector Skill Council, under the skilling ecosystem, are being done keeping in mind the best in quality. And how I can assure that best of quality, because we're involving the hospitals in the training. Like we have Mr. Rupak Barua sitting on the panelist today, and also is our chairman for the Eastern region. He also leads so many training for us within his own hospital. So I don't have to, have any doubts about kind of training which is being provided by the EMRI, in their hospital. So I think as we already heard from various speakers, even the Secretary Health spoke about this, and I think Chairman also spoke about this, how EMRI has actually lived up to the expectation of the West Bengal. So if we are doing training with them, if the skilling training is happening with these institutions, I think we can all be rest assured of the quality of the people which are coming out of these institutions, because they know what is required on ground. They know what is the skill set required. So our aim as a skill council is that we actually work people on ground. We actually work people which know what is the pulse of the ground, and we create our qualifications actually matching to those requirements. I heard Chairman said that we have a lot of less nurses as compared to Philippines. It may be the case, Chairman, but what we have decided in the governing board, and very intentionally this has been done, that will not go on creating the qualifications. We only wanted to create qualifications where we see there's an opportunity for people to get involved, getting the employment after the training, and which are required by the sector. So whatever qualifications have been created today, even this qualification which was launched by the Honorable Prime Minister, that feedback has directly come from the industry with us. So it's not that something, some people sitting in the Healthcare Sector Skill Council decided that this has to be developed. It has come directly from the industry, from the sector, from ground, that these are the requirements on ground. And that's how we have developed the qualifications. I would say, if DC is listening, I think seed somewhere has been sown by Dilip Chinoy himself while we spoke about this skilling so much. The best thing which we got in the Sector Skill Council is about the agility to respond to any crisis situation. So that's how we are supporting any of the initiatives of the government. We are supporting what is required to be done. The agility and with the speed which we can respond is something tremendous, which is inbuilt into the structure of the Sector Skill Council. And that's what we are doing today as well. What we have done with the 6 courses, just in case another point is like, I think Dilip Chinoy also mentioned about the Ayushman Bharat. So even before the Honorable Prime Minister had launched this Ayushman Bharat from the rampant of the red reports, we actually did the qualification for Pradhan Mantri Arogya Mitra. And we did started training even before that, because it was required that we should have training before that program is launched. We are continuously doing those training right now. So if you go to any hospital today, which is part of the Ayushman Bharat, you will find an Ayushman Mitra there sitting there, who's actually as an interactive person between a beneficiary, a patient, and the hospital. And that's the reason, that becomes a critical pillar for success of Ayushman Bharat in the country. So we have been very agile in trying to support and work what is the current requirement of the country. Having said this, again, very, very quickly, not going too much into detail what we have done. We have also tried about, finding out the international mobility for our certified people. So not only restricting, like I heard Chairman talking about making health, India as a healthcare skill capital of the world. So we are already working towards that vision of the Honorable Prime Minister to see that we become the skill capital of the world, at least for begin with healthcare, because healthcare is one area where I think we have doctors and nurses around across the globe, which are well respected as well. So what we need to now do is we have to do a similar thing for our allied health and the skilled health assistants also now. And that's another request which I keep on, started making these on several panels now. While we talk about healthcare professionals, we only talk about doctors and nurses. But I'm very happy to hear that in this panel, we had heard people talking about allied health and the skilled health, assistants as well. We have to talk about this cadre as well. This is a very important cadre which can actually support the doctors and the nurses, which are already in short supply to us. They can take a lot of burden of these people, of our doctors and nurses, and can actually make a real difference in the quality of services being provided today and the way healthcare services providing in the country today. So I think we need to recognize this cadre, we need to respect this cadre, and we have to bring in informally while we discuss this, about the healthcare professionals. I think we need to talk about these cadre much more now. As I already said, we currently work under the across country. We have been working closely with the West Bengal as well. We worked in the schools also of the West Bengals where trainings are provided. We work with the skill development mission also in the West Bengal for training as well. And as I said, with the efforts from Mr. Barua, we have been working with the industry directly as well within the West Bengal, and across the eastern region, the northeast region also. Quickly on some of the points which are raised by the panelists, I'm just going to talk about that. I think one focus which I could see and which is coming out and which is an input for us, and we already started working on that as well. One is that I think the large focus is about the aged care. We are saying that we have a demographic dividend, but that is going to be converted into an old age population soon. What happens to them then? So I think realizing that fact again, we already created qualifications for geriatric care aide and geriatric care assistant. So trainings are going to start on that very soon. We already are sending the caregivers to Japan, so which is again for aged population. So the trainings are happening, people are being sent to Japan for that as well. So we already have infrastructure ready, training component ready, we have the curriculum ready, we have the everything ready for which training has to be provided, which is specifically focused for geriatric care. Another thing is the home care. I think very important aspect because as an administrator, Mr. Rupak Barua has just said that this was a very important cadre, and we also believe through multiple studies what we have read across. Going forward, probably the healthcare services will shift from the hospitals to the home of a patient. It will be only tertiary kind of services which may be required at the hospital, but more and more services have to be delivered at home care, and technology is going to play a major role. Like I think our colleague from GE Healthcare and Mr. Bose also speaking about it. So technology is going to play a very important role, which means we have to have a cadre which can support at home care, providing the home care, which is a technical thing, and we need to have a technical support who can provide technologically, in terms of telehealth kind of facilities provided, how to manage them, what kind of requirements are there. So I think those are the other aspects we already started working on. We are creating qualifications around that. We'll see a lot of trainings coming in, and a lot of people would be in the market for those roles, which I think today there's a difficulty in finding such people. Our secretary also mentioned about preventive healthcare. In that sense, he spoke about, can we bring in, say, yoga also into it, or the other streams of the alternate medicines as well. I'm happy to share here that we have also been now mandated by the Ministry of Ayush to work on the Ayush roles also. So we already have our under the Healthcare Sector Skill Council. We had various roles which are under the Ayush sector now, which is approved by the Ministry of Ayush and has gone through the NSQC's approval also. For instance, yoga. For instance, like very important thing is Panchkarma technician, where is a lot of availability and job opportunity for people across globe, which is there. So we already started working on that as well. And I think as some of them mentioned about sanitization and hygiene associate, infection control, waste management. I think that's something which we are all working very, very closely. And you will see a lot more work which will be coming, to all of you very soon in these areas, because as rightly said, COVID, I think we have seen a downfall right now, but we do not know when the third wave will hit us. Even that, if we are not hit by third wave, it is still to be here for some time. So we had to learn to live with it. How best we can manage it, that's all I think we'll have to work on. And we are preparing for it, and we are working on this along with the sector experts. And I'm sure we'll together, I think with all the efforts of the healthcare professionals across both government and private sector, we should be able to sail through this as well. And I think skilled and the quality people, quality healthcare professionals will make a lot of difference to this. And we are committed to create that through our people, through our experts, through our governing board, and through our, the regional chairs. I think we're going to work toward that. And the idea is to include more and more people, more and more hospitals into it, and see that how we provide that training on ground. So I'll stop here. In case there are any questions, I'll be happy to take that. I understand we are already short on time. So anything specific, I'll be happy to answer.
Right. Thank you, Mr. Jain. And I'll go straight to the questions. I think the first one is something that you can answer, and it's open to all panelists. It's from Sumita Saha. Will you be focusing on home visit nurses like district nurses, support caregivers, which can be booked from a government setup, is the question. But if not, even if it's not from a government setup, if you would answer that question. The second question also, I'll just say, in case you want to answer that as well, is for geriatric services, how do you manage if senior citizens are not well versed in digital services? So it will be good for both you and maybe someone from health tech to answer this question.
Okay, so I'll quickly take on these two questions, and then maybe, as you rightly said, Chairman, somebody from health tech can support that. Answering about the second question about the geriatric aid, geriatric assistant. So what we do understand, geriatric population may not be, digitally literate in that sense, but I think that's also something is not so true today, because more and more geriatric population is also very, very well versed with the digital kind of things. But while what I was talking about the geriatric care assistant is, we are not talking about the literacy part of the patient or the geriatric population there. What we are talking about is creating a skilled manpower, skilled workforce who can deliver the services for the geriatric care, which will mean that we are going to train people, especially on the disease which are actually elderly are faced with, like a dementia or Alzheimer or things like that, so that they're specifically trained how they can help the elderly people in these kind of disease. So we are focusing on that. A digital thing will actually help them in monitoring them, and there are certain things which can help, which may not require so much of digital literacy on the part of the patient or of the elderly person, because those are being, we have devices like, and I'm sure a person from G Healthcare can, talk about that more. We have devices today where we have just to put on, on ourselves, and the readings directly goes to the physician or to the nursing or a supervisor somewhere where they can monitor sitting at, a distance place. So I don't think there's so much of a literacy which is required at a geriatric level.
Mr. Raghavan, would you like to add?
I fully concur with Mr. Ashish. So if you look at today, it doesn't need a significant number of skill set, because a lot of these companies have automated the entire workflow and simplified the entire user interface and so on and so forth. And if you look at the data coming in from all these remote systems, right? They're all getting aggregated at a centralized level. And one of the things most of the tech companies are trying to do is to see how we can provide a unified patient jacket, right? Consisting of all the data, what we need to put together. So I think Ashish is spot on. Nothing additional to add to that.
Thank you. Mr. Chakraborty, I think you had a question, and I think that will be the last question. Ms. Ghosh, please close the discussions after Mr. Chakraborty's question. Mr. Chakraborty.
Hello. Thank you, Rudra. I wanted to ask, we are working with a new nascent organization called EduSite, which works with the skill development of college graduates, primarily in the life sciences sector. And I'm also mentoring an organization with a very close friend of mine called Cura, which is working to develop technicians, mostly in the trained nurses and other professionals like that. The trouble we are running into mostly is to connect with prospective employees, like college graduates. Like right now, the COVID times, the entire colleges and the educational institutes are operating through in a virtual medium. So we are not being able to connect with the prospective college graduates and other people, graduates who might be interested in going in for skill development to get further employment. If there is a platform which is developed to connect these two ends, I think it'll be of much help. If there is such a move going forward, I would like to ask Mr. Jain from the healthcare services sector if there's any move to do something in this manner at a national level also, if possible.
Mr. Chakraborty, I think what you've asked is, one of the major pain point of the skilling as such. Mobilizing the candidates for training is something which is a difficult area for sure. But many of the institutions who are engaged into skill training have actually found a way out to it. And I can, very briefly, I can talk about saying one is, of course, like you mentioned about the colleges, and you go to them and figure out those. But in the current scenario, other way of looking at it is reaching out to the community. There are many of the communities and the NGOs which can help you actually connect with the prospective people who are looking for these kind of roles, which can get into engagement with this. About a platform, I think it is many of the state governments are actively looking at creating such platforms where they're bringing in the prospective people who are inclined to do this training, and people who would like to do the training as well. So it's like marrying together, where one set would be the training partners or training institutions who would like to train, and the other set people who would want to undergo training. So that is also something under development which is happening. But I would not be able to give you anything as of now, which is one place where you'll get the students across country, where you can actually get hold of them and get into training. But yes, if you speak to people around you, probably you'll find multiple other ways to actually mobilize these students for getting into training. And the best way, what we understand from is, if you can show them there is a job after this training, if you can assure them a job after this training, I think even a small advertisement or a small local advertisement may help you get those mobilize those students for your program as well. Thank you.
Thank you, Mr. Jain, and over to you, Moushumi. It's 5:30. I think we can close the discussions. Moushumi, would you like to close the discussion?
Sorry, I had got muted. Yeah. Thank you, panelists, for joining in. Thank you, Secretary General. Thank you, Chairman, for conducting the meeting. And I would like to thank all the participants who have joined in from nursing colleges, Pharma Association, the skill providers, the heads of hospitals, and NSDC, KIS Group, and a special thank you to MNG, the Mahendranath Ghosh Education and Welfare Trust, who has been working with us for several skill development projects. Thank you all for joining in. And Mr. Nigam, thank you most of all for being with us today. And we will send in the suggestions from Vicky and we will do a good report on this. And thank you, panelists, once again. Thank you, participants. Can you hear me? There's some.
Yes, we can hear you.
Yes, okay. Because I think I guess just, yeah.